The retina is the nerve tissue that lines the back of the eye. Occasionally, the retina can peel off the back of the eye or tear off the back of the eye, and that's what's called a retinal detachment. Most of the time, this is purely due to aging. Nothing specifically causes it, although occasionally it can be related to trauma. When a retinal detachment occurs, you may notice flashes in your vision, floaters, which are little spots or lines that move around in your vision, or a shadow in the peripheral part of the vision, which, if advanced enough, can extend to the central part of the vision as well. It's important to note that retinal detachments are not painful. There are different ways of treating a retinal detachment, but they all require surgery. And the most common way is a vitrectomy operation, followed by an operation called a scleral buckle. The surgery is performed in hospital, although in some cases it can be performed as a day procedure where you don't necessarily need to stay in overnight. To perform the surgery, we do this under local anesthesia where the eye is numbed so you don't see or feel anything, and so the operation should not be painful. The anaesthetist who is assisting the surgeon will also give you some sedation so you're nice and relaxed and calm. You'll need to lie nice and flat on your back during the operation, which usually takes about 1 hour to perform. The most common way that we fix retinal detachments is with a vitrectomy operation. And in a vitrectomy operation, we remove the jelly from inside the eye, we laser the retina back onto the wall of the eye, and we hold it in place with a gas bubble. The gas is crucial to keep the retina in place until the laser starts to stick. And because of this, your doctor will often ask you to position in a particular way after the surgery. Most commonly, this will be looking face down for up to 3 days, because the gas floats and helps press the retina onto the back of the eye wall. It's important to note that when you have the gas in your eye, you won't see very much out of that eye. But the gas will gradually dissolve by itself over a period of 2 weeks to 2 months. It's also very important to note that whilst you have gas in the eye, you can't get onto an aeroplane or go to high altitudes such as mountains, because the pressure would go up in the eye as the gas bubble expands. Removing the jelly from inside the eye in itself is not harmful to the eye, apart from one side effect, which is the development of cataract or clouding of the lens inside of the eye. So if you have a vitrectomy operation, you will normally get a cataract within about 1 year, and will require a second procedure or operation to remove this unless you have already had cataract surgery. The chance of repairing a retinal detachment is generally very good. About 90% of the time it can be fixed with a single operation. About 10% of the time the retina will want to come off again, and that's usually due to a scarring process that we call PVR. In most cases, when the retina is attached, there will be an improvement in vision, but please note that the vision will often not go back exactly to the same way that it was before you had the detachment. To learn more about how to look after your eye following retinal detachment surgery, please refer to the video on postoperative care following retinal surgery.